Hello, and good evening once again. Dr. Babaji Delalade here, Ask the Gynecologist, and I'm so happy to be here. Um, it's been a wonderful week, very busy one, most especially. You will have seen that over the last couple of days, I've not been available online. It has been very hectic at work, and like everyone listening to me, I'm sure you're busy with one thing or the other. And I work every day in the hospital, and sometimes when you get home, you're so exhausted, you just want to rest, and so as to be able to get in tune with the next day, and you're back again to the job. And the things we learn, the things we do every day at work, are the things we talk about here consistently. Most of you will have known that the things we say here are the things you will pay actually to listen from your doctor to tell you at a clinic. So I'm quickly checking my audio to ensure my audio is good. If you can hear me loud and clear, let me know. Eriola Sharon Akinola Amo, thank you so much and good evening once again. My name is Dr. J at Ask the Gynecologist. And if you can watch me here on Instagram, welcome and good afternoon. And if you can, and obviously, we're going to be publishing as well on YouTube. And at some point, we'll be doing live show as well on YouTube. Thank you, Ariola and Martha Toyin. On Instagram, we have Ziv Miracle, Joyfulness, Shalewa. Thank you. Shalewa says she can hear me loud and clear. Thank you, Shalewa. We have Zinat Abib Abdullahi and Lillian Ifea Diakanwa. Thank you, Ziv Miracle. So once again, I want to say welcome to everyone. Fumi Eletu and Ann Chidima Oji, Bolaji Ifeoluwa Abolaji. My name is Dr. J, and I always have that joy and that pleasure to be here every day, if I can, to discuss things that are very, very critical, essential to our well-being. If you've not listened to us at ATG before, you'll have realized that ATG is obviously a very wonderful group where we talk about females' gynecological health concerns, and we're trying to answer questions as much as we can. That's what we do here. We do it for free, and I say for free. We've only introduced fees over the last few months, few years, because we have to protect and reduce unnecessary, or I'll say large volume. Otherwise, we'll break down. I still remember the days when I used to answer people email, patient complaints, health questions on email after talking like this, and it was exhausting. After a while, my metacarpals were aching, as in seriously aching. You answer about 50 emails, you're exhausted. Sometimes you copy and paste. So we introduced these premium services over the last few years, and this is to ensure that we have one-on-one contact with people that have concerns at ATG. Let me tell you something. If you're watching ATG or watching me on YouTube or wherever you're watching me, it's by no mistake that you're watching me. Maybe your friend, maybe your colleague, maybe somebody that knows you, maybe a family member introduced you to ATG. They did it for a purpose, and it's for a good purpose. It's not by mistake that you're here, and you're here for a reason. The fact that you're listening to me is a testament to the fact that you are God's living testimony. Once again, I want to say, today's topic is how to understand baby's movement and when you should be concerned if baby's movements are not adequate or they are of a concern. And the reason why I've chosen this topic is because when I was on call last weekend, Friday, Saturday, Sunday, those were very, very busy times for me, and I experienced the various emergencies while on call. And I said that today I will take time to go through one or two of the scenarios where death would have been prevented, death was prevented. So if you're free tonight, I want you to pay attention well. If you missed this discussion, come back at your free time and watch it over and over again. I want to say my name is Dr. Lalade, and also I want to tell you to also read my recent interview excerpt by an online journalist, and I discussed about the state of healthcare in Nigeria and way forward. It's been published, and I've put up a link on our page for you to read the discussions and the excerpt from that an interview. There's a question here. I'll quickly answer that question before I go to today's discussion. By Peace Jeremiah Ejaji. What can anemia in a mom? Can anemia in a mom kill the baby in the womb? Anemia cannot directly kill the baby in the womb, but it depends on what is causing the anemia. If what is causing the anemia is life-threatening, then that anemia or whatever is causing that anemia can kill the baby or can even kill the mom. So it's not the anemia that will kill, but it's the primary cause of the anemia that can cause problems. So anyway, let's go to today's discussion. Today's discussion is about baby's movement. And I want to tell you something. Everything that lives moves. It might not be obvious. A tree might not move obviously, yes, but at some point a tree moves. Anything that lives will move. In fact, I always tell people that there's nothing called living or non-living things. We are all beings at one form or the other, and energy is a continuous state. It never rests. For questions now, hold up your questions till I finish my discussion, okay? Hold up for your questions till I finish this discussion. So everything that lives moves. The most important thing and the first concern a mom that is pregnant will have if the baby has problem is that, doctor, no, so my baby is not moving. When your baby's movement pattern changes, it's a big concern. Most moms, pregnant moms, will start to feel baby's movements from 18 weeks and above. If you've been pregnant before, 1 or 2 pregnancies before, you'll start feeling baby movements from about 14 weeks onwards. If it's your first pregnancy, it's usually going to be from about week 20, you start feeling baby movements. Before then, baby is moving anyway, yes, but you'll not feel it. In fact, from around 7 weeks onwards, baby's movements are obvious on scan, but because they are so tiny and they're so small, you might not feel the movement to an appreciable level. So baby movements are already there. But from week 18 or 20 onwards, you start having an idea of feeling the baby movement, and you start getting used to what characteristic movement your baby has. Now, before we go there, some people, they do have placenta in the front of their tummy, and they don't feel baby movements very, very often or very strong. Now, placenta can be in the front. We call it anterior placenta. Can be at the top, frontal placenta, can be on the side of the womb, okay, laterally, or can be down below the womb, blocking the cervix, which is the one you don't want. You can put your TV anywhere in the house. I tell people all the time, the only place you can put TV really is at your door. You got to open your door, so the door must be clear. Imagine your door is like your cervix, that is the exit of baby from the womb outside into vagina. So the cervix is your door. You can't put your placenta on the cervix. It blocks. Once you start to contract, you start to bleed because cervix is covering, or the placenta is covering the cervix. So placenta can be anywhere in your womb except the cervix, okay? Now, the cervix is the opening of your womb that opens from womb into vagina, where baby must pass through as you start to contract when you go into labor. So back to my description. Placenta can be in the front of the womb, okay, inside. On the side, at the top, frontal is the top, but we don't want it to be lower down, okay? Most placentas at the beginning of pregnancies will be on the lower side, but as the womb starts to get bigger, they get pulled up. Now, if your placenta is in the front of the womb, once baby is kicking, you might not feel the strength of placenta because the placenta acts as a cushion and makes you not to feel the strength or the veracity or the vigorosity of whatever of the baby's movement. So the placenta, okay, can act as a cushion, making you not to feel the strength or whatever it is of baby's movement, but you must still feel movement. Your placenta being in the anterior portion does not mean that you don't feel baby movement. It just says that it might not be as strong or might not be so obviously felt. Now, placenta can be on the side or on the top, okay? It can be on the top or on the side or in the front and on the top. So there are different variety. What we don't want is that placenta should not cover your cervix, okay? Some placenta can cover your cervix partially, some can cover it fully, okay? But that is what we call placenta previa. That is for another day. Now, back to our discussion about baby movement. Placenta can be in the front. If it's in the front, you will not feel the baby movement as strong. But essentially, baby still moves. Because your placenta is in the front does not mean, doctor, I didn't feel baby movement, but it's okay because my placenta is in the front. No, you should still feel baby movement despite the fact that the placenta is in the front of the womb. I hope I'm making sense. Now, once your baby starts to move, once you start to feel baby movements, you start to understand and have a pattern. Some babies move more during the day, some move more at night. Some babies change their movement from day, later they become night movers. It doesn't matter. And some babies too, they start to move around the time you have your meal or just after you had a sugary drink. They get the extra glucose from your bloodstream, they start to move. Everything you eat or drink or smell or taste as a mom will go through your placenta and your baby will feed on it. As a breastfeeding mom, everything you eat, drink, smell, taste will go through your breast milk and the baby will feed from it. So the baby is attached to the mom for a long time. That is who we are, okay? Now, back to my point. The baby movement must be there. You have to sit down at some point during your pregnancy to understand and have an established pattern of baby movement. You must know what pattern of movement your baby has. So if your baby is a night mover, understand that baby. If it's a day mover, understand that baby. The challenge comes when your baby is transitioning from an obvious nocturnal movement pattern baby to a daily one. Whatever be the case, even if baby is transitioning from one pattern to the other, night to day to night, you still pay attention to what your baby is doing, because this will help you to understand and to know if there's any abnormality or any critical or sudden emergent change in your baby's movement. And I'm going to tell you why these movements are very critical in diagnosing major emergency, major life-threatening emergency for the baby and from the mom. I'm getting somewhere, so listen attentively to me. So if your baby is already moving, it's as a pattern, maybe day mover or maybe night mover, pay attention. Whenever there's any deviation from the movement, it's a time for alarm to be raised or for you to pay attention more critically. Now, this is it. You should get at least one movement every hour. Some people will get up to 2 or 3 movements every hour. You should get one or two movements. If you're not feeling any movement at all in an hour, start pay attention. Suddenly, towards the end of that hour, baby starts to move again. Most babies will sleep for about 45 minutes maximum. They wake up again, not up to an hour. Babies do sleep. They get tired too, even in the womb. So they move, they stop, they sleep. But usually, if they don't move at all, okay, after or towards end of 50 minutes, they start to move again. They wake up again, they kick a bit. That should give you assurance. So you want at least minimum, okay, Reju, excuse my vernacular there, at least 1 movement per hour. If possible, 2 or 3, it's okay. Now, babies don't really move excessively because you can't run around the racetrack 24 hours. You must rest. It's nature. We have to rest. Even when the day rest, become night, day again, you must rest. So babies don't move perpetually. They must rest. They're human beings. They need to rest and replenish their energy. Okay? So babies will move, they stop, they move. If they stop, they're sleeping, it should not be more than 45 minutes. Maximum 50 minutes, they should get up. If it's longer than 50 minutes, start paying attention. It's important. Now, if your baby is a night mover and you're obviously asleep at night, what you want is that usually, pay attention, they will kick you at night to wake you up. Start counting. Once you notice any change, less than 10 movements overnight, start to wonder. But most babies are day movers. Now, if your baby is transitioning from day to night mover, pay attention until their rhythm is established. That is fine. Now, where baby movement is very critical is this. For example, a lady called in last week Friday. This is not a hypothetical situation. This is a real life situation here last week, exactly last week, Friday. She called into our unit, we call it fetal assessment, that nurse, midwife, obviously midwife this time, I can't feel my baby's movement, and my tummy is very tender. In fact, it feels rocky, hard, and painful. Without wasting time, the experienced midwife said, come to the hospital, let us monitor you. Okay, once we saw her, the tummy was very, very painful. She was bleeding. Clinically, she needed a cesarean section. She was about 35 weeks or so at that point. It has a classical clinical placenta abruption. She was sectioned and there was blood bleeding behind the placenta. Now, placenta, okay, should not separate before baby is born. After baby is born, the placenta will now separate, detach, and is delivered, what we call after birth. Baby is born, the after birth is placenta. The placenta detaches after the cord is cut or whatever, but it will detach after baby is born. If placenta separates prematurely before baby is born, it's called placenta abruption. Premature separation of placenta before delivery is abruption, is what we call placenta abruption. Is very dangerous. It can kill the baby. It can even kill the mom. Okay, it is very common with people that have what we call massive placenta, people that have severe blood pressure not controlled in pregnancy, people that are diabetic in pregnancy, people that their baby have so much water, what we call polyhydramnios in pregnancy, people that they've had placenta abruption before, people that have had cesarean section before, and so on and so forth. All these things can make a woman be at high risk for having placenta abruption, premature detachment of placenta before baby is born. So this woman came in. If you've missed this lecture, watch it from beginning again. Most of the question you're trying to ask or you're about to ask will be answered, if not already answered, before you got here. So watch this seminar or this talk from beginning again. You catch a lot. If you've never watched this program on ATG, you're missing a lot. And you should ensure that your friends, family, church members, mosque members, and society members are logged in and they are members of this gynecology group. If your friend, a woman, a man, is not in this group, they are definitely, I can say that with all surety, missing a lot. The things we say here are the things you pay for just to see a doctor for 10 minutes for. We say it here with pure heart, without collecting a fee and a dime, because that is what we are designed to do. I'm happy to do this thing every day of my life without collecting a dime, because that is what I'm designed for by the grace of God. And that is my purpose here on earth, to ensure that every woman is safe, gets pregnant safe, and delivers safely, if I can, in every possible way. So back to my discussion. So this lady came to hospital. She was having that bleeding, very, very painful tummy. Immediately we put her on CTG. CTG is where we monitor baby and the contraction and baby's heartbeat and contraction of the mom. And seeing that CTG, there was what we call reduced variability, C-section immediately, and there was serious massive blood clots behind the placenta. And the womb was blue, purplish blue, what we call covalia uterus, where the placenta abruption is obviously there, and the blood is now seeping into the wall of the womb, making the womb big, painful, and rocky hard. And so this woman was saved. The baby was saved, okay? Went into intensive unit, but fine, and it's okay. Now, lo and behold, on Saturday, that's last Saturday when I was on call again, another woman came in at 31 weeks. So I saw this lady. She was on CTG, where we monitor baby's heartbeat and mom's contraction. Baby's heartbeat was okay, but at some point, I was called by the midwife, Dr. J. They call me Dr. J anyway. This baby's heartbeat is very, very funny. It appears what we call reduced variability. So I said, continue the trace. After a while, we gave her some painkillers. I said, let's do a scan. I put a scan on this woman's tummy and I could see a large fibroid as big as 9 centimeters. Very obvious, well circumscribed fibroid in the womb. So I said, madam, has anybody told you before that you got a fibroid? She said, no. Okay, I went through her notes. She had a scan at 20 weeks. She even had a scan 2 weeks before then. That's 3 weeks ago, 2 weeks before that, me seeing her. She was 31 weeks when I saw her last week. So I said, nobody has seen a fibroid in your womb before. 20 week scan, what we call anomaly scan, even scanned at 28 weeks and scanned some few weeks ago. How come they missed this fibroid? This, as I said, this is unusual. Anyhow, I always love second opinion because nobody knows it all. So I called another doctor. I call her Dr. GS. She came in. Dr. G, what's happening? Okay, I can see a fibroid here. She put the scan on the scan. Very lovely lady. And she can see the fibroid too. Exact measurement I measured. Oh yeah, there's a fibroid here. I'm like, well, I don't know what's going on here, doctor, but I've checked the woman's scan. She never had fibroid before. She's in pain. Now, we said, let's do an MRI. After we made a request for the MRI, this woman's pain got worse. I'm like, ma'am, we got to keep you in. There's something going on here. Baby's heartbeat was okay at this point, but suddenly she started to bleed a little bit, trickle of blood. At that point, the tummy was getting more and more tender, and I knew this woman wasn't faking it. Some people are so low pain threshold, but this pain was getting worse. So we decided to consent her for C-section. We got the pediatrician involved because this baby is premature at 31 weeks. We called the pediatrician in. The pediatric registrar came in, and pediatric SHO, junior doctor, and also the pediatric nurse practitioner to resuscitate the baby, just in case the baby has problem with lungs. At that point, we gave the woman magnesium sulfate to ensure we can accelerate and do what we call a neuroprotection. Magnesium sulfate is given to women to protect the baby's neural tissue before they are born. So we give her that quickly on board. There was no time to give her steroids to mature lungs because everything was emergent. We went to the theater, opened her up, and you could see again, like deja vu, what we saw the day before: massive bleeding into the wall of the womb, placenta abruption again. We opened the placenta, and there were massive jelly thick clots came out. Now, where I'm going is this: these two ladies said in their history they started to feel that baby is not moving frequently as before. That is why, as a pregnant woman, baby's movement is very critical in everything you do. A baby that is not well, a baby that is not happy, will usually give you a sign. And the first sign an unborn baby will give you that there's something wrong is the movement starts to reduce. That is why if you're pregnant, you're watching me. If you're pregnant, you're watching me on Instagram or YouTube, you must do one thing. Pay attention to your baby's movement. That is once a woman tells me something that, doctor, I can't feel my baby move, I take them as serious as thunder and lightning. I take them as serious as light and day. A woman is almost 100% guaranteed to know about her baby than anybody on earth because she's with the baby before the baby was even conceived, while baby was still in conception, and when baby is born and as baby grows up. A woman knows her baby more than any doctor. If a woman says, I can't feel my baby move, even if I think she's lying, I take her serious at that point. So these two women made that same complaint. Their baby wasn't moving well. If these women are not paying attention to their baby's movement, lo and behold, they might not even know or be able to call that there's something wrong. That is why also, unlike our system here in UK here or Western world where there's a place a woman can call if she has any problem, in Nigeria, once you are pregnant, always ensure that you are booked in with a seasoned obstetrician that knows his or her onion well, so that if there's any problem, day or night, there's a number for you to call. I know it's a difficult thing, but if you're pregnant, try and get a doctor in your file so that you can call them on speed dial if any concern. Now, don't call them for funny things, but call them for serious things. Now, baby, if you don't know about baby movements, please watch the video from beginning. Baby movements are usually felt from 18 weeks and above if you've been pregnant before, or from 20 weeks and above if it's your first time. The reason why I say 18 weeks for people that are pregnant before is that because they are more experienced, they can easily feel baby movement. Now, the third case that happened again on Sunday. So now, Friday, Saturday, Sunday. Now you can see and understand why I've been drained all week and trying to gather my energy back. Now, Sunday, 8 p.m. I was about to close. That would be 9 p.m. 9 p.m. Nigerian time because we've moved backwards. Then this woman, another lady, pregnant lady, 37 weeks now. This woman has had two previous cesarean sections. And she's been booked for C-section, the third one at 39 weeks. She came in that 8 p.m. and the thing she said is that she told the midwife, I can't feel my baby. And once I saw that name, I'm like, I told the midwife, I know this name before. What happened to her? I was told she can't feel baby movement. I'm like, get her now into the scan room. I want to go pee. Because at that time, my bladder was full. So I ran to the toilet. I peed like as fast as Usain Bolt. I ran back into the scan room, put the scan probe on the abdomen, on the tummy. And at that point in time, I could not see baby movement. I could not see any cardiac pulsation. I could not see heartbeat. My head, my eyes were glued to the screen. I couldn't turn back to this couple. Her husband was holding her hand. I was trying to mutter and find words to say because whatever comes out of your mouth at that point in time will be remembered for life by this couple. Luckily for me, there was a midwife also holding the lady, trying to calm her down to say, don't worry, let's do the scan. As I saw that scan, I knew there was no heartbeat. The midwife knew there was no heartbeat, but I couldn't turn to face this couple. The lady asked me herself, doctor, is there something wrong? I can't see heartbeat. She knows, she's experienced, So I'm like, hold on, I can't see much heartbeat movement here. Let me try another technique. At that point, my plan was get a second opinion. So we called another doctor in. She came in, scanned her as well, and the verdict was given. There was no heartbeat. Now, do you know how devastating, how heartbroken, how painful, how shattering such a news is to a woman at 37 weeks? I'm sure she is expecting a baby. She's prepared a room in her house for the baby. The other siblings know the baby is coming. And it's painful. I didn't even know what to say. And I was perplexed. But, once we confirmed that there was no heartbeat, we had to, cancel the lady, call the consultant in, and we continued the plan, regime, and treatment and explained things to her, and we took it from there. I'll stop there on that note. I'll continue back to baby movement. Essentially, to what this woman noticed at that day was, she said the day before, she felt sudden, sharp movement, like a rumble, from the baby around 7 p.m. That's about a day before that Sunday. And since then, that Saturday, she didn't feel movement up until the time she came to the hospital on Sunday. And she think that was the time baby passed away. Was there something she could have done? Maybe yes, maybe no. Was there something she's done? Maybe yes, maybe no, I don't know. Was it preventable? Maybe not, maybe no. This lady had baby start tracing on the day before, on 2 days before, baby was fine. She was seen for pain in her tummy, in her right upper tummy, but she never complained of baby movement issue. But all of a sudden, on Saturday, baby moved so violently, baby stopped movement, and Sunday she came to hospital. What might have happened? This woman decided to have a C-section because she's had 2 previous C-sections. There was no cord tied that could have said that there was blood cut off to the baby. No. There was no obvious abnormality on baby's body. And there was no smelly, foul-smelly liquor, maybe infection that has infected the baby. No. There was no abruption or like bleeding beyond placenta, like the one I explained before. No. So we don't know what might have caused. Maybe we'll get more reports as the week comes by. But what I'm trying to say here is that there was a sudden movement before there was no movement. What might have caused that? We don't know yet. We might be more wiser in future. But baby's movement is critical for baby. If you're not sure, you think there's a change in baby's movement, do one thing for me today. If you take one thing away from this discussion, don't ever double guess yourself. If you notice anything unusual, out of the blues, different from what you know, what you've noticed, what pattern your baby has established as their movement before, suddenly there's a change in what you know in their normal, usual, habitual movement, it's time. Don't leave for the next 2 hours. It's time for you to get help as soon as possible to check that baby, to ensure that baby is fine. The most important thing about a baby in the womb before baby is born is their movement. What? Movement. What again? Movement. Two things essential: movement, movement, movement. No movement, concern. Get checked out. Get checked out. They'll do heartbeats, listening. They'll do ultrasound scan, and everything that can be done in that environment to ensure baby is fine must be done as soon as possible. I don't pray to see this in anybody. I don't wish this on any woman listening to me or any woman out there at all. My prayer is that babies don't die before they are born. Babies don't die before their birthday. God will not let us see that again by the grace of God. Now, I'm going to open the floor now for questions now, because I'm sure lots of people, lots of ladies do have questions they want to ask, and I want to open the floor. Doctor, please, your phone number. Vivian Ophia. Obviously, I can't put my phone number on the screen here. If I put my phone number on the screen, I will start getting buzzed every day, every second. No, if you want to consult with me one-on-one, please use our premium services. Vivian has already given you, the link to subscribe to the premium services so I can go through things with you. Miriam Suzette is asking, what is the cost for missed period 10 days and my period came out so painful, breast is so big, what is wrong? Maybe your hormones are not balanced. Maybe you were pregnant, maybe you had a miscarriage, maybe it's just a normal cyclical change, okay? Is vitamin E good for pregnancy? Vitamin E has no real significant place in about getting pregnancy or about doing antenatal care. What you need is pregnant care. Pregnant care contains all the things you need in pregnancy in the appropriate proportion for all you need. So get pregnant care and use that during your pregnancy, okay? We are still on Instagram. People are still watching us on Instagram. The seminar for this month on how Clomid and Letrozole works is going to be November 28th at 8 p.m. Is it 8 p.m.? Yeah, sorry, 9 p.m. West African time, 8 p.m. UK time, 9 p.m. West African time. Lady Rocky Mickey, how are you? Wonderful. Doctor, how can you know baby gender? You can know your baby gender through ultrasound scan, usually from 20 weeks and above. Some people with good scan, 4D scan, you can even know the gender from 16 weeks and above. But with normal scan, you will know the gender of baby from 20 weeks and above. There are some rashes on my stomach. What might be the cause? It could be allergy to some things, allergy to your detergent, to your soap you're using. It could be infection, but you need to get it looked at by dermatologist. What if one starts going to MAU every day and baby stop? You can't go to MAU. MAU is maternal assessment unit. You can't go to MAU every day. It doesn't make sense. It become a nuisance at some point. You only go there if you're worried and genuinely worried about baby movement, okay? Multicentrum, uncomfortable, pregnant care is all everything you need, please, okay? You have scanty period, 2 days before your period late. You have low abdominal pain, a week, do an ultrasound scan to check your womb, and also get a hysteroscopy done to check your womb cavity as well. You're pregnant with goiter, you did a scan, bulky uterus, you didn't need to worry. Just ensure that you get your thyroid hormones checked, and that if there's any aberration or abnormality with your thyroid hormone, they are treated by an endocrinologist throughout your pregnancy, okay? And be monitored for your baby's growth scan all through pregnancy from 28 weeks onwards, every 33 weeks, okay? You have posterior placenta. Your placenta is basically, if you watch the video from beginning, I explained where placenta can be. And I also explained what posterior placenta is, okay? So posterior placenta is when placenta is at the back of the womb, okay? It's normal, okay? And grade 0 means that it's so beautiful. Placenta is perfectly normal. What makes a baby sit in pregnancy and what can be done? Sit. I don't understand. A baby sits. How can a baby sit in pregnancy? I don't understand what you're saying. Babies are in the womb. They don't sit down. White spot found in your unborn baby's heart mass. Oh, you mean echogenic focus? In most cases, it's not nothing to worry about. Okay. Can a baby be born at 34 weeks? A baby can be born at any time. Okay, but it's not mature. If a baby is born before 37 weeks, it's not matured. Okay, but full maturity, 40 weeks. From 37 weeks, babies that are born are able to do okay. Before then, they might need support. Okay. How do you know you have high prolactin? By doing your prolactin level checked. You do some blood tests to check your prolactin level, and they will know if it's high or not. Patience Dogu, I don't know what you're saying about quarterly something. Go talk to our moderators, okay? They have all the links and all the services we have regarding consultation, okay? Can implant family planning delay one from getting pregnant when one is ready? If it's taken out, it doesn't delay you. Once you remove your implant family planning, it doesn't stop. Usually within a month or two, regular sex, no other problems, you get pregnant. When should one go for the first scan? You should go for your first scan at least at 12 weeks pregnancy, so that we know how long you have an idea, and also be able to give you your due date estimate. If you had a previous miscarriage before, previous ectopic pregnancy before, you should get your first scan at 6 weeks, okay, to ensure that baby is in the womb. Your baby kicks sideways instead of up and down. Movement is movement, okay? And babies can be breech, okay? Breech means their head is up, okay? Babies can be anyhow, but from 36 weeks onwards, they become head down. If your baby is not head down from 36, 37 weeks onwards, then you must see a doctor so that we can discuss options to get baby to turn or to decide the next plan for mode of delivery. Okay, so most babies can be any position up until 36, 37 weeks. Okay, before then, don't give yourself any headache. Okay, because if you scan your baby now, this morning now, it can be head down. You scan tomorrow morning, it could be head up, and it can be any position before you are 36, 37 weeks, okay? So it doesn't matter where baby is, okay? But from 36, 37 weeks, you want it to be head down. If it's not head down, then you get to see a doctor. Okay? Thank you guys for watching me today. I really appreciate it. I hope to see you later again. Tomorrow, I'll be bringing a guest speaker here. He's a wonderful guest speaker. You don't want to miss him. He's been here before at ATG. He's going to talk about antenatal care and also about gynecology. So don't miss tomorrow. It's going to be 4 p.m. Nigerian time. You'll be here to discuss with you. Hope to see you all soon, okay? Have a wonderful weekend ahead as well, and have a wonderful day. From me to you, most importantly, I love you all. My name is Dr. J, and I ask the gynecologist. God bless you. See you soon. Bye-bye.